I'm excited to get some time today with Dr. Karam Chandani, who is a clinical neuropathologist here at the Montreal Neurological Hospital, as well as associate professor at McGill University. It's an honor to get some time with you today to learn about pathologists and what that clinical specialty is like. And I thought I'd jump in and just ask you, what's it like to be a pathologist and what's changing in that environment these days from when you started out?
Thanks for having me, Michael. It is the macroscopic assessment of specimens and human tissues, so just looking at something with our eyes, palpating it, getting a sense of what the tissue is like, looking at it under a microscope, and establishing a tissue-based diagnosis. So I've had the luxury of practicing in different practice types between my practice in Toronto and here in Montreal. Back in Toronto at St. Michael's Hospital, I practiced both anatomic pathology and neuropathology. And what was really interesting to me is to see how much the practice of pathology has changed in the last 30 years. If you go back and look at a pathology report from 1991 for a breast specimen, you would see breast, the localization, so breast, right, mastectomy. Because back in 1991, that was really the only procedure they had for cancer. So even the number of procedures that produced a pathologic specimen was far smaller in number than it is today. And if you had a good pathologist, not only would it say invasive ductal carcinoma, you'd have a semicolon and it would say margins clear or free of carcinoma. So your margins were good. And not all reports contain that. If you look at a breast cancer report specimen today, it is almost guaranteed to be a minimum of 3 pages long.
If one is interested in becoming a pathologist or one of the subspecialties of pathology, what's that career path look like?
In most provinces, it's a 4-year undergraduate followed by a 5-year residency in anatomic pathology. The pathway is slightly different here in Quebec, where some students out of Cégep can go directly into a combined medical student post-secondary training, but the residency part is still common. And increasingly, for practice in academic centers, at least a 1-year fellowship is required to practice subspecialty pathology within anatomic pathology. In Canada, the practice of neuropathology is its own separate residency. And what's an interesting trend in pathology is an increasing number of subspecialties and certificates recognized by the Royal College called areas of focused competencies. So cytology is a good example of a relatively new area of focused competency in which a 1-year fellowship is officially recognized by the Royal College.
How has the technology changed since those days?
We're living through a very exciting and dynamic time. The foundation, as I said, hasn't changed. We're still using hematoxylin and eosin as our initial screening tool to look at cells under the microscope. How we look at those cells is different depending on where you practice already. So some centers, including the University Health Network in Toronto, have already migrated to a digital pathology-based workflow in which those slides are scanned and digitized, and the histologic interpretation happens in front of a computer screen and not a microscope.
I was wondering if you could elaborate a little bit on how remuneration works for pathologists.
There are private clinics and there are non-private clinics, many of which are hospital-based. The mechanism of remuneration is also individual across provinces. Many pathologists working in the public system in Ontario are remunerated on a salary basis.
I see.
And so the hospital remunerates to a certain level. In Ontario, that level happens to be supplemented by the provincial government to assure a minimum base salary for all the pathologists operating in that system in that province. Here in Quebec, we operate on a fee-for-service basis in which pathologists perform clinical acts. Those are documented and billed to our RAMQ, the equivalent of OHIP in Ontario, and the remuneration is based on individual acts to a capitated level of 1.5, what is expected of a pathologist's full-time work. Alberta operates on a pay scale in which the pathologists are remunerated differently based on their years of experience and how long they've stayed in Alberta.
What's a typical day look for you?
No two pathologists in this country have the same 24 hours. Most of us have varied roles across educational, clinical, and administrative activities. And so we all have very different looking days with a lot of common looking elements. In the last 24 hours from yesterday afternoon, I had clinical sign out where I signed out almost exclusively brain cancer cases before heading to our new super hospital to meet with the residents in the capacity as a residency program director. This morning, I'm trying to remember I started my day. I started my day in meetings, in administrative meetings, trying to organize our new distributed hospital network. That's a trend that's affecting many pathologists across the country, by the way, as different hospitals are amalgamated. People are familiar with the LHINs in Ontario. Alberta led the way with the largest consolidation of laboratory practices. It's happening with the BC Cancer Agency or BC Coastal Health Authority. Saskatchewan's doing this. In Quebec, we refer to this as OptiLab, but the centralization of laboratory management is a trend taking place across the country. Following my administrative meetings, I participated in some quality assurance activities. I had to score the College of American Pathology External Quality Assurance Program for our fluorescence in situ hybridization for HER2 testing. I went to the neuro, where I had attended a tumor board, or multidisciplinary tumor boards as they're referred to, in which our neurosurgeons, radiation oncologists, nurse practitioners, and pathology were all present at the same room. We went through the clinical presentation, radiology, pathology, molecular findings, and then go ahead and, as a team, decide what the best treatment options are for the patient. And then I came here.
I'm glad you're here. Is your day, would you say it's somewhat similar hours every day, like from 8 till 7 kind of thing every day, or are you on call after hours?
Typically, one of the advantages of this particular specialty is we do have sort of consistent hours. And as a father with 3 young children, I've enjoyed the luxury to be able to go home at night and read my kids their bedtime story. Even if I work a little bit after they go to bed, I largely have hours that I can predict. For those of us practicing neuropathology, we tend to have more call. So I'm on call approximately 1 day in 2 through the year. So I'm on call almost every other day. But for most pathologists, I would say it's under 20 days a year.
What's the level of burnout with that group?
If you look at the organization charts of many hospitals or hospital networks, the lab is considered something you just need to have in order to run the clinical operations. So there's been a disconnect between recognizing that this is not a service, but actually an integral part of clinical care. Hospitals will also often make decisions with implications in the labs without considering them. So an example at St. Michael's Hospital, here's a good example. They built a large new wing on Queen Street, new emergency, new surgery rooms with more theaters, more operating theaters. More ORs mean more specimens. But unless the planning goes in to increase the laboratory capacity, what you end up is a downstream consequence, which puts pressure on pathology and other laboratory physicians. And that's not always perfectly well thought through. So I think my Canadian colleagues are under a lot of pressure in that volumes go up and the relief is not transmitted to the laboratories and pathology.
They're getting busier and busier.
Busier and busier.
I see. Well, I can't thank you enough for the time. I mean, I've learned a ton about just neuropathology, pathology in general. Having a window into what it's like to be a physician like you and what you've gone to get to where you are. It's just, it's an honor to get some time to understand that. And we're looking very forward to a long and fruitful partnership between MD Financial and the Canadian Association of Pathologists. So thank you very much for the time today.
Thank you for having me.